So good afternoon everyone. Myself is Mrs. Gayatri, working as a Vice Principal in Sri Shanmugam College of Nursing. Today we are going to discuss about the guidance and counseling. So guidance is nothing but we are providing for a guidance to any students or anyone else. So what is the purpose why we are providing for a guidance and counseling? To get any ideas or any problems will be easier. We are providing for a guidance and counseling. Now we are going to discuss about the counseling. Counseling is defined as a face-to-face relationship in which growth takes place in the counselor as well as counseling. It's nothing but so always we are conducting a counseling face-to-face reaction relationship we have to maintain, and if any problem will be is that the counselor will be giving for a solution to the counseling. One more definition: counseling is an interaction process that facilitates meaningful understanding of self and environment and results in the establishment of goals and values for future behavior. For example, if I want to work as a staff nurse in foreign means what I have to do? I want to get a clear counseling from those who are working in the particular place. That's the reason we may get for a clear picture. Definition of guidance. Guidance is a process of helping individuals to understand themselves and their world. So guidance is a process through which an individual is able to solve their problem and pursue a path suited to their ability. It's nothing but we are providing for a guidance. For example, one guy is doing for any problem or psychologically he is having any issues. What we are providing? We are providing for a guidance, and they have to get a good pathway to understand themselves itself. It's a problem like that they will be having the any queries. Immediately we have to sort out the problem and we have to reduce for the problem. That's why we have to provide for a counseling to them. What are the principles of guidance and counseling? Guidance and counseling is a universal requirement. It's a goal-oriented. Guidance and counseling is a continuous process. It's a student-centeredness, professional activity, prevention as well as cure. Then the flexibility, cause and effect, development of insight. So once again, we can so in this condition, if you are moving to the guidance, so a lot of guidance is there. So what is the main, what are the types will be is the person will be having the marital guidance, the person will be having the issues in the health. So what we are providing for a guidance. Okay, so it's a health. For example, everyone above 45 years, they will be having the lot of health issues. They cannot able to go and check for it in a clear manner. Why we have to provide means through with help of guidance and counseling, the health they can able to go and check it. They can have a clear picture about their body for the prevention of the disease. Next, we are moving to the types of counseling. Types of counseling is nothing but number one, direct counseling, non-direct counseling. Number two, short counseling. Number four, long counseling. Then clinical counseling, student counseling, elective counseling, then psychological, psychotherapeutic counseling. These are all the types of counseling is there. Then sometimes the children will be having the other types also: placement counseling, vocational counseling, individual counseling, problem solving, then dietary counseling, then they will be having the behavioral, then they will be having the group, then sometimes they may have an intercession also. This is the problem we can identify one by one. So directive counseling is nothing but the counseling also known as the prescriptive or counselor centered counseling, because in which the counselor have an important role or solving the problem. By giving emphasis on the problem, counselor is supposed to be authoritative person, and he identify and he has to get the definition. What is a problem? Definition is nothing but define. So what is a problem? They have to define. Then we have to identify the diagnosis, what are the problem will be occur. Then we have to provide for a solution to the particular problem. That is a directive counseling. Directive counseling, face to face we have to identify, and we have to give for the counseling to the children as well as to the adult person also. Non-directive counseling. So this type of counseling is also known as a client-centered counseling, which counseling is the active participant and counselor is the passive participants. Both the thing we have to identify the problem, then we have to give for a counseling either in the through telephonic or sometimes they are giving for a mailing also. We can give for a non-directive counseling. Then short-term counseling. Short-term counseling is nothing but, so within a short duration they may have a certain problem that we have to give for a counseling. This kind of counseling is used to situational crisis which can lead to a distribution of life which concern of the client or family or community. It can be relatively minor concern or major crisis. Sometimes they may have a short-term attention will be easier. So immediately you have to sort out the problem and you have to provide for a decision making in a within a short duration. Long term counseling, it's nothing but the word itself meaning is a long term. Continuously we got to provide for a counseling. For example, the schizophrenia or mania patient will be is a, they have cleared the disease condition but they still having the some little bit worries. What we got to do, we got to provide for a long term counseling. It extends over a prolonged period of time. It may vary daily, weekly or monthly basis. It is focused for the client who experiences developmental crisis may need long-term counseling. That we are telling as a long-term counseling. Sometimes a person will be having the woman with the menopause, then the mother will be having the breast cancer. They will be having the feelings of one breast removed means they may get for a depression. At the time we want to provide for a counseling to them. Next, elective counseling. It's nothing but the counselor will use both either directive or non-directive. Both the method we are calling as a elective. So according to the need, we have to provide for a elective counseling. Clinical counseling. So many members will be coming to the clinical counseling. What is the reason? Nowadays the workload will be increased, then dietary activities they are not following means obesity will be occur. They may get for the feelings. Okay, so that's why when they are coming to the hospital, immediately we have to provide for a clinical counseling. It is used for the diagnosis and treatment of mind functional maladjustment and to find better adjustment and self-expression. A relationship primarily individual face-to-face between counselor and client is describe the problem and also suggest the solution or remedy for the problem. For example, if I am going to the hospital, the doctor will be telling you are having the overweight. What we have to do? I have to reduce my weight. If you are not maintaining your ideal body weight, you may get for a cardiac problem. Like that, so many issues will be easy. That's why always we have to provide for a counseling to prevention aspect. So that is the better for our health. Psychological counseling. Psychological is nothing but, so the person will be having the psychologically they may have a disturbance due to some love affairs or any other problem will be is so sometimes the family will be having the issues. So at the time they may get for an emotion. We have to provide for a psychological counseling in which is simply and conversation between the client and therapist. We have to provide for a counseling. We have to ask the question. According to the question, according to the problem, we have to take for a necessary action and we have to provide for a counseling to the patient. That we are calling as a psychological counseling. Then psychotherapeutic counseling. Psychotherapeutic therapy is nothing but treatment. Psychologically trained individual consciously attempts verbally to assist the other person to modify emotional attitude which the subject is aware of the personality recognition through which he is undergoing. For example, the patient will be or the any other person will be having the mood swing or they may have a thought, suicidal thought. At the time we got to provide for a psychotherapeutic counseling and we got to monitor for the patient. Next, student counseling. So many members will be having the problem. Concentration I'm not getting. I cannot able to get for a good mark. Like that, they may have issues. What we got to do? We got to provide for a student counseling. It's concerned with the helping the students to solving the problem pertaining to the choice of educational institute. Sometimes what type of course they can take, that and all we can give for a student counseling. After joining the college, they may have adjustment problem. That also we got to provide for a counseling. Vocational is nothing but job. What type of job they got to choose, everything we can provide for a student counseling. Next, placement. So after completion of course, they can able to choose for the good placement according to the situation. We have to provide for a right placement is very important, in which counseling in regard to job and post which are suitable to the client depend upon his abilities, attitude and interest. So important questions, especially types of counseling approaches, what, when, where, how we have to provide. So we have to follow for the principles of counseling. We should not include the activities to everyone, and the characteristics counselor should listen and calm, and always we have to approachable person. Then we have to give for a more importance to the guidance and counseling. So these are all the things we have to identify. Thank you.